In this week's Cardiology Countdown, we'll look at risk factors peri-hysterectomy, silent Afib as an important risk factor, and a question of is less more with ICD placement. So we'll begin with an interesting study of about 3,000 women that looked before and after hysterectomy, with or without oophorectomy, and looked at various risk factors. In the past, it had been seen that there may be increased cardiovascular risk in the large studies and trying to understand the coronary risk factors behind that. And interestingly, this was a moderate-sized study with about 180 women having one of the two surgeries, and they actually did not see much of a change in LDL, HDL, ApoB or A1, CRP before or after hysterectomy. And they took some reassurance in that. And so not as bad as one might think. Obviously, one would only need that, undergo that surgery if needed. But in terms of cardiovascular risk factors, not a big change induced by it. Next up is another interesting study looking at diabetics and subclinical atrial fibrillation. And so they have known that diabetics have had silent evidence of cerebral infarction in a high percentage, and it's not really been understood why. And brief episodes of atrial fibrillation leading to embolism might be a cause. And so this group did an observational study in 464 diabetics, all of whom were on aspirin, and did 48-hour Holter monitoring to try and detect subclinical atrial fibrillation. And they matched that to normal healthy patients and found that about 9% versus 1.6% had brief episodes of atrial fibrillation over those 48 hours. And those patients were at very increased risk of developing a stroke, and interestingly already having evidence of stroke on brain imaging at baseline. And so the number of stroke events was 17 versus 6 over the next several years. And so this opens the door, I think, to more screening potentially of patients. I think it needs to be defined exactly in whom, but the concept that there's maybe more atrial fibrillation out there in high-risk patients than we might otherwise think, and it has the expected consequences. And the number one pick this week is a paper in JAMA from the NCDR in the ICD registry that looked at the difference in outcomes of single versus dual chamber ICDs. They looked at patients for primary prevention of sudden cardiac death with ICDs in a little over 32,000 patients, and patients who didn't have an indication for pacing, and compared dual versus single chamber devices. And they found no difference in all-cause hospitalization or hospitalization for heart failure in the two different device types. But in the propensity matching, complications were lower in the single-chamber device. And so they asked the question appropriately, why would one put in a dual chamber device if there weren't an indication for pacing and it has more complications? And so an area of further scrutiny of getting the appropriate device for the appropriate patient. So for this week's Cardiology Countdown, I'm Chris Cannon.